Hi everyone, my name is Olivia. With all of the news surrounding CASPer, Snapshot, and Duet, also known as the Altus Suite, I wanted to talk to an expert about what effects these will have on the application cycle. So, I'm joined by Dr. Ed Lipsit. Dr. Lipsit is the Associate Director of Advising here at MedSchoolCoach, and he's also served on the Admissions Committee at the Virginia Commonwealth University. He'll give us a general overview of each tool, and I'll follow it up by asking some questions from the student perspective. Here we go.
Well, it's a pleasure to be here. And the topic that I'm going to address is one that actually causes a fair amount of concern for medical school applicants. It's the CASPer exam, and it's really called the Altus Suite, which includes the CASPer and two other screening tools called Duet and Snapshot. And let me just give you a little bit of background. Around 2002, 2003 at McMaster University in Ontario, um, they developed what's called the multiple mini interview format. It was in response to a criticism that the conventional interview or the traditional interview was too subjective. So they came up with this idea that maybe situational judgment type questions would be important. So that kind of revolutionized to some extent the interview process. So the CASPer exam is kind of an offshoot of the multiple mini interview format. That's the DNA of the CASPer exam. And the CASPer exam really came into vogue around 2014. At that point, a handful of schools picked it up, and now it's been increasing to the point where almost 50% of the schools utilize the CASPer in some way or form. And most of the schools are using it, again, as a screening tool, not necessarily as a substitute for either the traditional or the multi mini interview format. So, let's talk just a little bit about the CASPer. And so, what does the acronym stand for? Computer based assessment sampling of personal characteristics. Uh, that's saying quite a lot. Basically, it's a situational judgment test. And, these types of tests, they're trying to evaluate the individual's ability to articulate problem solves, show their judgment, maybe some bioethical dilemmas that they need to solve. And in addition to the CASPer, again, which came along about 7 years ago, something like that, they expanded on the CASPer. So now it's called the Altus Suite. Altus is actually a company that was formed on the campus of McMaster University. And they now present a suite of examinations. So what do we have in the Altus Suite? We have the CASPer, which screens applicants for, they call it non-cognitive competencies. In other words, they're trying to judge the individual, again, in terms of their ability to solve problems and to articulate answers to dilemmas that they're presented with. Then there's a fairly new exam, which is just beginning to be introduced, which is called the Snapshot. Now, the Snapshot, it's a video response tool to probe applicants' skills and motivations. Think of Snapshot as a mini traditional interview that they're adding to the CASPer exam. And then finally, there's the Duet, and that's called a value alignment assessment. What happens is the individual actually gets to fill out a questionnaire. The schools fill out a questionnaire, and then they compare the responses to try to size up the individual. Are they a good match? Are they a fit for the school? Now, you have to understand, some of the motivation for these situational judgment tests. There are some tremendous benefits to the institutions. They are cost efficient, very cost effective to administer to large numbers of candidates compared to the other types of testing. Um, the personal statement in the application is important. Structured interviews are important, but this is a very efficient way for schools to evaluate applicants. It's standardized. It's basically computer driven. And it just makes life easier for admissions committees, I think. So, what exactly is the CASPer? The CASPer is both video-based and word-based scenarios. 12 sections. 8 of them are video clips that the individual responds to, and this is all on their computer. And 4 of them are word-based scenarios where, again, you're given a paragraph that describes a problem, and then you have to respond to it. Now, after each scenario, 3 questions are asked, and the individual has 5 minutes in total to type the response to all 3 questions that follow the scenario that's presented. There's an optional 10-minute break partway through, and supposedly spelling mistakes, typographical errors are ignored. But it's important for an individual to be comfortable with the keyboard, because that's the type of examination that they're taking. So, what does the individual need? Obviously, to be prepared for the exam. An appropriate browser, a stable internet connection, a keyboard that they can work with. So those are just some of the basics, of course. And I think the best preparation, you can't anticipate the enormous number of potential questions that can be asked, but the individual can at least be familiarized with the format and the requirements, take some sample exams so that they're comfortable, again, with the format. To some extent, that's about all you can do. And these scenarios are general ethical dilemmas, which at least the folks who developed the CASPer believe are encountered in everyday life. Here's a little bit of the mystery. The individual programs, the individual schools determine exactly how they're going to use this and how much emphasis they're going to put on it. And that's not revealed to us. The other thing that's not revealed is exactly how it's scored. Apparently, there's an individual assigned to each and every question. They want some independence in terms of the evaluation process. There is a score that's created and that's passed on to the schools, and you don't get to see your score. So there is a little bit of mystery associated with these types of exams. So in summary, how is the CASPer utilized? Well, most schools are now using it not as a substitute for the conventional interview, but as a pre-screening tool. It can facilitate decisions for candidates that are maybe on the cusp, on the edge. They may have a cutoff score to screen out applicants, or they can use a very high score maybe to include applicants that ordinarily they might reject. So I guess you could say that it's part of their attempt at a more holistic approach to evaluating applicants. I'll give you an example of a question that actually has been posed on the CASPer, such as this. Think of a time when you had to make a sacrifice in order to accomplish a goal. Now, the 3 questions for that scenario are: briefly describe the situation and the sacrifice you made. Do you regret your decision to make the sacrifice? Why or why not? Why not? Did you learn anything from the situation that can be applied to your desired career? So, they start out pretty much with a bit of a soft question, and then it gets a little stickier. And usually I advise applicants to read all 3 questions to eliminate redundancy and to answer the questions at hand. And as I said before, when I started out as an advisor, this was back around 2014, 2015, there were only a handful of schools that were using the CASPer. And now it's approaching almost 50% of the schools. Just one more thing. Again, 6 representative scenarios. typed responses to each prompt, and an evaluation by an advisor. That's the MedSchoolCoach CASPer interview prep. Basically, it's representative and it allows the individual to become comfortable with the format. So that's CASPer. Now they've added another examination, which some schools require now, others feel it's optional. It's called Snapshot. So what's Snapshot? Snapshot is a video response tool which supposedly probes the applicant's communication skills and their motivation. And I look at it as putting a face on the applicant. In other words, the CASPer is pretty cut and dry. Again, it's got the MMI DNA, the MMI heritage. So now we're kind of softening the CASPer a little bit by allowing the individual to present more of in more of a traditional format. So, what exactly is the CASPer? It's brief. It's a 10-minute extension of the CASPer, and only individuals who have either registered for the CASPer or taken the CASPer qualified to do Snapshot. So, in other words, currently it's not being used as a standalone exam, but rather it augments the CASPer itself. It's a one-way interview in that there's no true interaction. You're recorded. 3 questions with 2 minutes to read and respond to each question. And again, these questions are going to be more of the traditional questions. I'll give you an example. These are possible questions that I think are representative of the Snapshot. Tell us about someone you admire. What's your favorite book? Have you read a book of interest lately? Is there some obstacle that you've overcome? And many times they qualify that. They don't want to hear about, the hassle that you had in organic chemistry, but rather, is there a non-academic, some very personal obstacle that you've overcome? And, they could ask you a general question like, what excites you about medicine? So, obviously these are softer questions, and I think they complement I'd almost say the rigidity of the CASPer examination. Now, I kind of like the idea of the Snapshot. This is a personal commentary on all this, because I think it probably was in response, I'm guessing that it was in response to maybe a little bit of criticism of the CASPer being a little bit of an overreaction to the subjectivity of traditional interviewing. So it complements it. Now, finally, there's something recently introduced, which schools are trying to figure out whether they really want to get involved in this. It's called this value alignment assessment, or the Duet. Namely, from what I understand, and there's not a lot of information about this because it's so new, but it simply seems to be a matching process where you fill out a questionnaire, the school fills out a questionnaire, they look for overlap of responses, similarity of responses. It's kind of a program fit. I believe you're taking a little bit of a chance by taking that exam, because you're trying to anticipate and also match, quite frankly, the mission statement of the school. Now, one of the reasons why and this is a personal commentary on this, one of the reasons why I'm a little critical of it is because my feeling is that within the primary application, you can state much of your own personal mission and motivation within your personal statement. And not only that, but most of these schools, as you know, you send in your primary application, and then usually over the summer, the year before matriculation, you get these secondaries. And many times the secondaries, which are small school-specific applications, those secondaries will have you discuss in essay form why you're applying to that school, what is your motivation, does your mission, does your personal statement mesh with the philosophy and the personal and the mission statement of the institution. So for me, I'm kind of wondering why an additional assessment of your motivation to attend to that school is necessary. But that's just off the top of my head. Nonetheless, though, it may be at some of these institutions that you have no choice if it's not considered optional and if it's part of the entire suite that you're required to take. So there's really no way that you can prepare for the duet except thinking long and hard about why that school was on your list. And my feeling as an advisor is that every school on your list, you should have a good reason for it being there. And if you don't have a good reason, then, I mean, really, why are you applying? So it's something that should be part of your thought process anyway. Now, interestingly, there may be more situational judgment tests on the horizon. In fact, the American Association of Medical Colleges, the AAMC, has come out with their own SJT, or situational judgment test. And right now, there are about half a dozen schools that have actually adopted it and are requiring applicants to take it. So it's you'd almost call it in competition with the CASPer. And what's of interest to me is that UC Davis now requires it. If you go to their website, you'll see that. And that's powerful. That's important. For one of the University of California schools to adopt this means that this test is here to stay, and you may see other schools following suit. So the bottom line is there are more and more, I'd almost call them hurdles, that the applicant is faced with. However, if you understand the exams, the purpose of the exams, and if you understand the format, that'll help you be successful. And it's simply becoming part of the application process. So it behooves the applicant again to learn about these exams, become familiar, and you don't have to go it alone because there are plenty of advising services, including, of course, MedSchoolCoach, that have developed programs to familiarize the applicant so that they can do well and be successful. I'm happy to take any questions that you might have.
Thank you so much. That was a great overview. I learned more than I thought I would. Having been through the cycle, this most recent one, I took the CASPer myself, and I was wondering, my first question, so when I was going through the process, AAMC had released the VITA interview, and that was a required part of our application process. And I'm wondering how that compares to the ALTIS Snapshot.
I actually think they're very similar. They're basically they're one-way interviews. What gives people trouble, and obviously you did very well and you handled it well, so my compliments to you. But one of the problems is with these one-way recorded interviews, there are no visual cues. And I'm sure that when you're interviewing with an individual, either in person or online, they're reading you and you're reading them, right? And I'm sure that you react to their facial expressions, maybe even their composure.
Right.
And often, you could tell whether you're on the right track or not, whether you understand the question completely and you're providing a response that's appropriate. You get these visual cues. There's none of that, with the VITA, which is kind of similar. The VITA, I think, is a little bit longer, a little bit more extensive, but it's really in the same category of assessment. And again, I'm finding that at first, when the VITA came out and I learned about it, I thought that some schools might be using it as a substitute for conventional interviews, but they're really not. At least most of the schools that I know of, I know UCLA in particular, so I've had a number of applicants that I've worked with who've applied to UCLA, and they've used it as a pre-screen. Even if you excel at the VITA, that's wonderful, but then you move on to the conventional interview.
Okay, thank you. On the line of sort of potentially substituting the conventional interview. Do you think that's where this is headed? Are we moving away from conventional interviews, or is this always meant to be a supplement?
Well, a couple things. There's been some debate, interestingly, with my colleagues at MedSchoolCoach. I've taken a stand that's many don't agree with. I think you've seen the future. I think that even though many people believe that an in-person interview adds another dimension to the process, I don't disagree with that, but I don't think it matters anymore. I think that schools have found this to be so efficient, so cost effective. And from the applicant standpoint, you really don't have to go running around the country, which can be very time consuming and also very expensive for individuals. So I think the online type of format is here to stay. I don't think these exams are going to be replacing either the traditional or the MMI format of online interview. I think this is, in addition, it's complementary, not competitive. And I do believe that these will stay, at least for the near future, as screening tools. Basically, they're just throwing more at you. I think, and again, this is just personal opinion, I think schools are struggling with, number one, the overwhelming volume of applicants. Look, Geffen, UCLA, 14,000, Georgetown, 14,000, LECOM, an osteopathic school, 15,000, overwhelming numbers, okay? And, I think I've seen thousands of files, to be honest, to tell you the truth. And the caliber, the quality of applicant is extraordinary. In fact, it's disappointing that so many worthy individuals may not gain acceptance just based on numbers. And I think the schools are having a lot of trouble differentiating individuals. Everybody's, got the great GPA. They've got a really solid MCAT. They've done extraordinary things with their lives, either the research or the volunteer work or the teaching or the leadership. They fill the categories beautifully. And you just scratch your head and you go, we need we need more differentiators. And so I think they're simply adding more of these hoops to jump through, more of these hurdles to go over. I think the intent is good. Sometimes you might even get some information overload about individuals and how do you make these decisions. So I think it's becoming more complex for the applicant and for the committee. In fact, I almost feel a little bit of a sympathy for the committees now because, again, they're inundated with such extraordinary applicants. So I think their hope is that with these additional tools, they can sort of narrow it down and maybe make their life a little bit easier when it comes to selecting the very top individuals to have conventional interviews. Because as you know, only 8, maybe 10% of the applicant pool actually gets to the interview stage, that there's ruthless screening of these applications, just getting to the interview. And when I do interview preps with individuals, I congratulate them for getting an interview. It's, that's what we're dealing with now.
Okay. Yeah. So you mentioned how earlier this is very easy for a school to pick up. It's cost effective. It's a very efficient system. And on the student end, at least when I went through it, it was a free requirement. So I didn't have to pay to take the CASPer or anything like that. And if I'm guessing correctly, it's still free right now, but do you think a cost will soon come for students?
Well, that's a good question. I'll tell you who's paying for it right now. It's the admissions committees. It's the schools, the institutions. Again, it's just sort of a little side note, but I've done a lot of research on Altus. And again, this is a company that was founded by individuals who worked in admissions at McMaster University. Okay. In fact, one of the co-founders, Dr. Harold Ryder, he was chair of the committee and has done a lot of work and published many articles in the academic literature, some of these, arcane, educational journals about the significance of the situational judgment tests. The premise being that situational judgment tests, such as the CASPer, they actually posit that they do a better job of identifying individuals who will be successful in medical school and make for great doctors. They posit that this type of testing is superior, or certainly complements the standard traditional criteria, which includes the metrics, the personal statement, the activities list, the letters of recommendation, all those things that that you're familiar with. So yeah, I mean, you bring up a good point. This could be a push, ultimately, to maybe replace some of the traditional criteria. But right now, it's a complement. Right now, it's a compliment. But you bring up a good point. I mean, I really don't know for sure exactly how schools are going to incorporate this in the future. But right now, it's a screening tool.
Got it. So one of my last questions here, you mentioned how the sort of assessment of fit test there, the Duet, is a risky game you might be playing if you decide to take it. And in your opinion, you said you have to really know why you want to be with that school. And I'm wondering, is it one assessment that gets sent to every single school? And if so, how can you set yourself up for success if you have to take it?
Well, you only get one shot at these exams, as you know, during each cycle. Okay. And if you designate a school to receive it because they've required it, or if you've given the option and you've decided that you're going to make that move, they get that exam. I have not seen the Duet questionnaire. I don't think anybody has. So there's a little bit of mystery and intrigue here. But like I said, it's somewhat of a match game. And my thought process was that the secondary application is probably the best method, or a better method, or at least it's a method that you can understand in trying to explain why you'd like to go to that institution. And of course, if you do get to the conventional interview stage, you'll probably have an opportunity to explain yourself. So, again, it's a little bit of a match game, and you just have to hope that the way that you answer the questionnaire matches or is compatible or simpatico with the way that the admissions committee has filled out their questionnaire. Because from what I understand, then the folks at Altus make an assessment as to whether you're a good fit, you're a good match. It's almost like, to some extent, maybe matching, for your residency. So, I mean, that's just my thinking on this. But it may well be. And my prediction is that this Altus suite of exams, all three, that you're not going to be able to pick and choose, that I think that schools are going to subscribe to this. How they use it is maybe where they're going to vary, but they're going to use it and they're going to require it. And so it behooves the applicant to at least be knowledgeable, understand the origin of the exams, the format of the exams, and just be prepared.
Okay, awesome. My last question in particular to the CASPer, I remember I was worried about it going in, but if I'm not a particularly great or speedy typer, is this something I should spend some time doing? You think that's a big limiting factor?
Well, there's some time management that's involved here. Sure, absolutely. In fact, it's one of the things that I'm a little critical of it, only because you're introducing that element into the equation. When in fact, I really wonder if if one of the criteria should be how facile you are with typing. I mean, I'm a hunt and peck person. People laugh at me. I took typing. I just couldn't do it. So I'm hunting and pecking, and I know I would be at a disadvantage. well, to be honest, I probably couldn't get into medical school now, to be frank. So for me, that's sort of one more obstacle. And again, they say that they actually say on their website, when I've done some research, that they advise their evaluators to ignore, typographical errors and, errors in typing and grammar. But I really wonder, I mean, that probably shows poorly, if you're riddled with errors. So I think that's another element that they've introduced. And I just wonder so you have to understand that the CASPer, it's about 7 or 8 years old. Although its development was earlier, but it was instituted around 2014. I think you're seeing the first generation of CASPer. So it could be that as we move on, I mean, if you think about the online format and the technology, even just 7 years ago. So I'm wondering if we're not dealing with a little bit of an old school exam that may be modified and changed as we move forward, right? And move away from the word scenarios and the typing, and move a little bit more towards the online interaction that we're doing right now. So you see a change in the CASPer. I don't know.
Okay. You gave me one more thought for a question here.
Yeah, sure.
Speaking of a changing CASPer, maybe an older version that maybe I would have seen, I was pretty interested. After I took the CASPer exam, I got an email saying I was one of a couple hundred maybe students selected to receive their score from the CASPer exam. Right. I don't know how many other people saw it, but even then, I barely remember what the number was because it was so arbitrary. They just gave me a number and didn't tell me really what it meant.
Right.
And so I'm wondering, do you think that's where this is headed? And without scores, how are you best able to assess how well you're doing when you're preparing to take the CASPer?
Yeah. Well, a couple of things. Number one, that is I'm trying to figure out the name to put on it. That's an experimental program. You were part of a small group. I'm not even sure what the purpose of that was, but anyway, it's only a small subset of individuals. The vast majority of individuals, they do not get that kind of feedback. In terms of knowing how you're doing, again, this is not a sales pitch, but the fact of the matter is that MedSchoolCoach has a very innovative program. What happens is, as these exams become introduced, again, as these hurdles, are introduced, I found MedSchoolCoach to be very innovative and to react to this. Because part of their mission statement is to respond to the needs of the applicants, of the clients. And so they come up with programs such as they have a virtual shadowing opportunity, because that's a problem that's developed, right? People, they lost their shadowing opportunities, so they've come up with virtual shadowing. Well, for these type of exams, the situational judgment tests, there's a prep, and the prep includes 6. And I know this because I've participated in it and I prep for this. There are 6 scenarios that are presented to the individual in advance. Then there are 3 questions, very similar to the format. The individual then goes through the typing out their responses. Then I, as an advisor, as part of the program, I get this in advance. I look it over, I critique it. Then we do an interactive where we discuss each question and how it was approached. And what I have found is that just that simple exercise, the anxiety level of applicants just drops immediately, because at least they know something about what they're going to be contending with. They've gone through the process of typing out responses, looking at 3 questions, thinking about the 3 questions as an entirety. One mistake that people make is they focus on the first question. They don't look at the second and the third. So they give an answer to the first, and it spills over into the second, and it spills over into the third. It's not a unified response. So these are little things that can help the individual. But again, I found that maybe 90% of the battle is familiarity with the format so that you're comfortable and you can kind of relax and think about the questions rather than the mechanics of how am I going to get through this thing.
Thank you so much for doing this. I learned so much, and I hope anybody else watching this will learn equally as much, if not more.
It's my pleasure, and good luck to all.